Okay, we're back, and in this video lecture, we're going to be talking about some concepts, and this kind of leads into our earlier discussion about the difference between an EMR and an EHR. EMRs are single organizations, perhaps single provider electronic health records. We talk about EHR systems, we're talking about things that go across multiple sites, sometimes even multiple organizations. And to do that, we need to understand the concepts of interoperability. For instance, within Kaiser, we have several different regions. Not all the builds are the same. So as the different field lengths are different lengths for name and what have you, some of the information doesn't carry over. For instance, between the two California regions, we would sometimes have vaccination lot numbers not come over correctly because of the different file lengths. Now you might ask yourself, why did they do something like that in the first place? That's a great question. And I don't really have the answer for that, but here's what I do have. I do have some information on the concepts of interoperability, and I'd like to take a look at it with you now. And again, I think we left off here talking about health information exchanges and regional health information organizations. One of the biggest challenges is the issue of patient information security. So we need to have a HIPAA compliant notice of privacy practices. We see these when we go to the clinic, but they're even more important when you're exchanging information between two different organizations. And with the American Recovery Reinvestment Act, Public Law 111-5, health information exchanges are enhanced through funding mechanisms and national efforts to develop nationwide health information exchanges. With the new administration in Washington, we'll see if this continues, but for right now, we're still somewhat on track, at least as much as anything else is as of late. So the American Recovery and Reinvestment Act of 2009 was important for several different reasons for those of us in health information management. Most importantly, we had the HITECH Act, the Health Information Technology for Economic and Clinical Health. This provided incentives for organizations to adopt electronic health record technology. And again, there with over 500 different vendors when I last checked of different EHR systems, some of them were clearly better than others, right? So then part of this legislation was to have meaningful use objectives, as CMS said. In other words, it can't just be something that has limited value, right? And these regional health information organizations involved into health information organizations and exchanged information, labs, diagnostic tests, imaging, payer information, all these different things. And ultimately, the e-health exchange, which is just getting off the ground now, connects all 50 states and is used by federal agencies such as CMS, Social Security, and the VA. Some components of EHR systems that you'll find in all systems include the bullet points on this. And that includes data. Data is basically raw facts without a context typically. These are numbers, letters, images, symbols, and sounds. Data is organized in hierarchy, which is a character, right? And a group of character forms a field, right? Which is a grouping of data. It could be a date of birth, could be a last name. These are things that are common to all patients, right? And if we collect all these different fields that belong to a patient has a first name, a last name, an address, and so on. That is a record. And you'll learn more about that in HIM 125. We'll do some examples on that, what have you. After data has been collected, it's giving meaning and is used for decision making. Data then becomes information. So if we say somebody's, say a date, March 11th, 2001, that really doesn't have meaning unless it's tied to other fields and given a context. And then we can say it's one particular patient's information, and then it becomes information. And of course, health data is basically data, the raw facts without a context that aren't processed, letters, images, symbols, what have you, right? And then when it gets in the context of being related to other fields, what have you, the health data becomes health information. Now we have two different categories of health information, two major components, as your slide says here. They're administrative applications and clinical applications. And these are things like demographic information, insurance information, payer information, guarantor information. All these are examples of administrative information. And this is the kind of stuff that typically gets entered into the admission discharge transfer system in the hospital. If you've ever been admitted to the hospital and go through admitting, they key this information in. With clinical, this is stuff related to patient care. These are the patient monitoring systems, the medication records, labs, imaging, nursing notes, provider notes, all these different types of things. In addition, we also have the patient access applications. If you've used MyChart, get a patient portal, you can see the results of your lab, see your bill, all these other things that are allowed by this patient portal. Now, again, all these information technology systems need to communicate and exchange data with different systems. And this is where interoperability comes in. And you could think of interoperability as the ability to share data. In the earlier announcement, I think I may have mentioned the concept of different field lengths. Field, you can kind of think of as a grouping of information, like a immunization or a vaccine lot number, right? And if one system uses 11 characters, another one uses 20, the one system that has 20 characters can't send the information over to the one that uses 11. That's just a very simplistic example of interoperability challenges. So we need interoperability. Your second bullet point here says it's essential, and it really is. Otherwise, we can't really share information. So now how do we get beyond health data and health information? Well, for the data to be useful, it's got to be managed. And what we mean by manage is we have to have policies, procedures, and methods of managing it. Who can create it? Who can store it? How long will we keep it? And this gets into the second bullet point, which is data governance. Data governance must occur within facilities to ensure the only quality data that's recorded is recorded in the electronic health system. We don't want to have all these little shadow systems where providers are giving out services and no other providers or payers know what's happening. And that leads us to the third bullet point, which is data governance. And this is the concept of creating policies, processes, and procedures that manage our data. And if we're going to manage data, we need to manage information. And this is information governance. So we need to have organization-wide policies, principles, and practices that focus on not just managing data, but managing information. Who can access it? who can share it, who controls the release, and so on. So two very important concepts. And the data and information that's used in healthcare organizations only has value if you can manage it. If you don't have policies on timely completion of records, it really doesn't help keep records accurate, complete, and useful. The American Health Information Management Association's established information governance principles for healthcare. Health information professionals have to ensure that the data and information governance occurs in organization. So some principles include the principle of accountability. Who is responsible? Principle of transparency. Principle of integrity. Can we rely on the data? Is it truthful? Principle of protection. Is it secure? Principle of compliance. Right? Complying, in other words, is it legal to keep this information? How do we release it or so on? Principle of availability, right? You can have the best electronic health record system in the world. It's of limited use if it's not available. Then we have the principle of retention. How long will we keep it? And then the disposition. When it's no longer valid, what are we going to do with it? And then information systems, as you can see in this cycle, this is common in a lot of information systems. We have the design, the development, right? So we determine the needs, we design something, we implement it, we test it, we operate it, we maintain it, and sooner or later systems become obsolete. So what do we do with them, right? You see this a lot with mainframe systems where they call them legacy systems, right? People still have the information available, but it's not as readily accessible. Organizations have to have policies and procedures as to how they will deal with this. And that's all I have for you. Come back for our last video lecture on chapter 5, where we'll talk about databases and other types of emerging technology. We'll see you then. Bye now.